Morning, students. Today we will learn about the fetal circulation. We already that topic started. Today we will discuss about the steps in to the fetal circulations. Okay, so there are many steps helpful for the fetal circulation. In that step one, the placenta accepts the bluest blood, means blood without oxygen, from fetus through the blood vessels that leave the fetus through the umbilical cord. Means maternal placenta accept the blood without the oxygen. Okay, so which can help the fetus for the blood vessel that leave through the umbilical cord. This is the step one. In step two, when the blood goes into the placenta, it picks up oxygen and it becomes the red. So while the blood enter into the placenta, it picks up the oxygen level, and due to the blood color it becomes the red. Okay, this is the step 2. Next step in figure, this is the fetal circulation figure. Okay, so we already discussed about the five structures. Okay, that is ductus arteriosus, ductus venosus, then umbilical cord, umbilical artery and umbilical vein. Okay, so these all are a structure. And in step 3, the red blood then return into the fetus via the umbilical cord, means umbilical vein. So the blood, see in this figure, you can easily understand. Okay, so the blood which carries through the umbilical vein. Okay, in step 3. In step 4, red blood that enters into the fetus and passes through the fetal liver and enters into the right side of the heart. Means same in our heart system, there are four chambers, but in fetus that these are five structures are included for the fetal circulation. So in that, now red blood is enter into the fetus for passes into the fetal liver and enter into the right side of the heart. Okay, so see, from the umbilical vein, the fetal heart enters into the liver, and from liver it is into the right side of the heart. Okay, this is the step 4. Step 5, foramen oval allows the reddest blood to go from the right atrium to left atrium and then to left ventricle and out of the aorta. So as a result, blood with the most oxygen gets into the brain. So this is the main mechanism for brain. Okay, function of the brain. Fetus having a maximum oxygen, purest oxygen from the maternal placenta. So now the reddest blood go into the right side atrium to the left and see in this figure you may find easily. So from the liver to right side atrium to right side ventricle, and from right side ventricle to right atrium to left atrium and left ventricle to aorta. So it can easily pass to the fetus brain, okay, and gets maximum oxygen to the brain. So this is the step 5. Okay, so in this figure, same, from right atrium to left atrium to left ventricle and through the aorta, it will goes into the fetus brain. Okay, so this is the step 5. And step 6, the blood coming back from the fetus body and also enter into the right atrium, but the fetus is able to send this blue blood from the right atrium to the right ventricle, means the chamber that normally pumps blood through the lungs. Okay, so what the blood doing, that is the fetal body accept that oxygenated blood and also enter into the right atrium, but fetus is able to the send blue blood from the right atrium. Okay, so that is a mixing of the blood occurs. Most of the blood that leaves right ventricle in the fetus bypass the lungs through the second of the two extra fetal connection, which is known as the ductus arteriosus. Now what is the ductus arteriosus in this figure? See, the mixture of two blood occurring into the this space, which is known as the ductus arteriosus. And okay, So right ventricle in the fetus bypass to the lungs, and second two extra fetal connection that is known as a ductus arteriosus. Okay. So two mixture connection between the fetus structure is known as a ductus arteriosus. Clear? So this is step 6. Okay. Easy to understand. These is all are steps of the fetal circulation. In 7th step, the ductus arteriosus send the pure blood to all organs of the fetal body and lower half of the fetal body. Now the function of the pure blood is passing to the all fetal organs and body and remaining portion lower portion of the fetal body from where that is ductus arteriosus, and this also allows for the bluest blood to leave the fetus through the umbilical artery and get back into the placenta to pick up the oxygen. Now blood is a purify from the oxygenated. So these also allow the bluest blood but leave to the fetus through the umbilical artery and get back into the placenta for repetition oxygenated blood. Okay. So this is step 7. Clear, these all are steps of the fetal circulation. Now we will discuss about the pathway, means in summarization how can you remember these pathway and 7 steps of the fetal circulation. So in first we already discussed that is oxygenated blood from maternal placenta through the umbilical vein. This is the main topic. Always you remember that the vital circulation starting from the umbilical vein, because from maternal placenta to fetal we have to reach the oxygenated blood. So it started from the umbilical vein, goes into the fetus liver and receive the deoxygenated blood from the portal vein. So from the fetal portal vein deoxygenated blood is received, and through ductus venosus it will goes into the inferior vena cava. From that, right atrium to heart, and foramen oval, left atrium of the heart. And from left atrium of the heart, it will goes into the left ventricle of the heart. So this is the whole pathway of the fetal circulation. And from the left ventricle of the heart, it will divided into two, that is during ventricle systole, left ventricle blood and right ventricle blood. So what occurs into the left ventricle blood? It formed an ascending aorta and distributed by the branches of the heart, head, neck, brain and arms. So it will divided into these all are organs of the fetal body. And what is the function of right ventricle blood? With less of oxygen level it contains is discharged and pulmonary artery ductus arteriosus. By the help of ductus arteriosus in descending aorta it will goes, and from that hypogastric arteries is goes into the umbilical artery, and through that it will goes into the maternal placenta for the deoxygenated blood and receive the purify of the oxygenated blood. Okay, so this is the whole pathway and summarization of the fetal circulation steps. Okay, now what kind of the changes occurs at the birth into the circulatory system? Okay, so in the fetal body, these all 5 structures are included, but after the birth of baby at some age, these all our structure is closed. So the circulatory changes occurs after the birth. So we will discuss that the placenta is replaced by the lungs as the organ of respiratory changes. Okay, so placenta is replaced by the lungs and known for changes of the respiratory extent, and the lungs and pulmonary vessels expand, thereby significantly lowering and resistance to blood flow. So now the function of the lungs is started here, and the function is lungs and pulmonary vessels now expanded for reaching the high blood flow, okay, to the or all organs of the fetal body. So subsequently, the pressure in the pulmonary artery and right side of the heart is decreased. So now the pulmonary artery and heart right side is a blood flow is a decrease, and the pressure of the left side is a increase. So obviously at one side the pressure increase, so opposite side it will be decrease. Okay, so right side it will be decrease the blood flow and left side the increase heart blood flow. Okay, so by the increasing pressure of blood flow in the left side of heart, it decrease the vascular resistance of the lungs. Obviously if blood flow in the heart left side is increased, so the vascular changes is a decrease of the lungs. So therefore the blood now enters into the lung as a respiratory accent. So by this, the respiratory function started, and the now in blood flow enters into the lungs for a respiratory exchange. Okay, so this is circulatory changes occurs after the birth. Now what happens to shunts at birth? So why the shunt is necessary? So closure of the ductus venosus, foramen oval and ductus arteriosus. Those structure who are included into the fetal circulation are closed at some time after the birth of baby. So where they are closed, okay, so closure of the structure we will discuss. So first we will discuss that is the closure of the ductus venosus. The functional closure occurs within a minute of a birth. So after a birth of baby, within a minute the ductus venosus is closed, and structural closure occurs within 3 to 7 days. So the whole structure takes time of the 3 to 7 days of closure time. Okay. Then after it close, the remnant is known as a ligament venosum. So after the ductus venosus close, it will be known as a ligamentum venosum. Okay. So the name will be replaced. Then the closure of ductus venosus is caused due to the strong contraction of the muscle wall of the ductus venosus, but the cause of this contraction is not revealed yet. Okay, so why the ductus venosus is closer? Due to the contraction of the muscle wall. Okay, so this is the closure of the ductus venosus. Next, that is the closure of the ductus arteriosus. So it is closure of ductal arteriosus is by smooth muscle contraction. Okay, so it is further replaced by the fibrous tissue and known as a ligamentum arteriosum. Okay, so the ductus venosus is known as a ligamentum venosum and ductus arteriosus is known as a ligamentum arteriosum while it flows then after. Okay, at the birth time, opposite direction of the blood flow from aorta to pulmonary artery, it supplies into the more oxygenated blood than the before. Okay, so after the birth of baby, the direction of blood flow will be changed from aorta to pulmonary artery. Oxygenated blood are exchange. Okay, so these contraction of smooth muscles occurs due to because of the increase in availability of the oxygen. So oxygen level is high, so that the contraction of smooth muscle will be occur, and the degree of smooth muscle contraction is highly dependent on more availability of the oxygen. Obviously if oxygen level is increased, so the smooth muscles contraction also become high dependent, okay, on the availability of the oxygen. So this is the closure of the ductus arteriosus, which is known as the ligamentum arteriosum. Okay, last, that is the closure of the foramen oval. So before the birth of baby, foramen oval allows the oxygenated blood entering into the right atrium, and from that inferior vena cava it is passed into the left atrium. We already discussed into the steps of the fetal blood circulation. So okay, before the birth of baby this process is a continue, but after the birth of baby, the close at the birth due to decreased blood flow from the placenta and inferior vena cava to hold the open foramen. Okay, so after the birth of baby, the blood flow will be decreased from the placenta and inferior vena cava become the open foramen oval. Okay, so more importantly, because of the increased pulmonary blood flow and pulmonary venosis return to the left heart, it causing the pressure in the left atrium higher comparison to the right atrium. We already discussed in previous slide. Okay, So the blood flow is increased into the left side compared to the right side. Okay. So the increased left atrial pressure then the closes the foramen oval against the septum septum secundum, okay, between the right and left atrium. So it will be increased. So the output from the right ventricle now flow the entirely into the pulmonary circulation, okay. So the output is increased into the right ventricle, flow in entirely into the pulmonary circulation. Okay, so this will be happen into the closure of the foramen oval. So this is three structure where it close and what is the name of the replacement. Okay, so in image there is a difference between the before birth and after birth. It will be situated. See, this is the image of the before birth of the baby. Okay, so maternal placenta, this is the maternal placenta, and circulation occurs into these organs, and after the birth it will be cut by the umbilical cord cut from the babies. Okay, so maternal placenta and cord are divided, so no separation between the baby and placenta because baby is outside the mother's womb. Okay, so now circulation also changes after the birth. So that's why their structures are closes after the birth of the baby. Okay, and for the summarization of topic, the what kind of the changes occur in fetal circulation after the birth. So it will be described in this table form, that is the shunt 3, ductus arteriosus, ductus venosus and foramen oval. While it close, so functional closure, that is 10 to 96 hours after birth in ductus arteriosus, within several minutes after the birth in ductus venosus, and foramen oval close at the birth of the after the birth of baby within a minute. Okay, then anatomical closure of this three structure, that is 2 to 3 weeks after birth in ductus arteriosus, 3 to 7 days after birth in ductus venosus, and in foramen oval after the 1 year after the birth of baby. So this is the maximum time which structure takes for the anatomical closure. What is that? Foramen oval. And what is remnant? So means replacement name of these three structure. So ductus arteriosus known after the birth of baby, ligamentum arteriosum. Ductus venosus is known as the ligamentum venosum, and foramen oval known as the fossa ovalis. Okay, so this table is you have to remember. And umbilical artery and vein is known as the umbilical ligament and ligamentum teres. Okay, so this is the topic of the fetal circulation and what kind of the steps into the fetal circulation and how the three structures are closer at one time. Okay, so this is about the whole fetal circulation topic. Okay, so if you find any doubt you may notify to me. Okay, so thank you.